So our goal today is to help you guys. I mean, you're not necessarily reopening because you've been allowed to be open this entire time. But what we want to do is provide you guys with some education during this phase 1 reopening directive that the governor issued on April 24th. And we've been putting out a lot of resources and information for a lot of different establishments, and we didn't want to forget you guys. So we want to make sure that you guys feel like supported and that you have the resources available to you that you need during this time as well. So phase 1 reopening guidelines for hotels, motels, bed and breakfast, and tourist homes is what we're talking about today. Hopefully you guys are all familiar with this, this Montana reopening the Big Sky Directive. This is the directive that Steve Bullock, our governor, issued on April 24th. And there's some guidelines in here specific to all general businesses, individuals, and employers that we're going to go through with you guys today. So what does this mean for you guys? Obviously, you've been allowed to remain operational because you've been considered an essential business during this entire emergency. But these phase 1 guidelines, like I just said, have specific recommendations and requirements for general businesses, employers, and individuals. One thing that you guys do need to be aware of is that effective immediately, unless modified by a new directive, gyms, pools, hot tubs remain closed. So if your hotel or establishment has a hot tub or a pool, that does need to stay closed during this time. Okay, so this is right where I got that. I just copy and pasted it straight out of the governor's reopening directive, and I'll show you where you guys can find this directive online, where it states that gyms, pools, and hot tubs need to remain closed. And then it's important to remember that although we are starting to reopen some businesses in phase 1, the virus is still in our community and it's still very dangerous, and it's still taking the lives of a lot of Montanans. And so it is our individual responsibility as Montanans to take the adequate precautions when we're going out in public. So we need to continue to practice good hygiene, washing our hands as often as we can, and after we're touching high touch surfaces, avoiding touching our face as much as possible, sneezing and coughing into our elbows or a tissue, and washing our hands afterwards. Disinfecting frequently used items as often as possible, and consider using a face covering when you're in public, especially if you can't meet those 6 feet social distancing requirements. And then obviously don't go out in public or go to work when you're sick with especially COVID-19 symptoms. And we'll go into that a little bit more. So specific to individuals, everybody needs to be following these guidelines in the reopening directive. We really want to touch on vulnerable individuals. So if you or yourself or your staff are meeting the definition of a vulnerable individual, so you're over the age of 65, or you have any of these underlying health conditions outlined in the definition there, we really want you guys to be making sure that you're taking extra precautions and being as safe as you can. We're recommending that you still stay at home in quarantine during this phase 1. So we don't want those vulnerable individuals working right now. And then individuals need to avoid gathering in groups of more than 10, especially and then don't even gather in groups of 10 if you guys can't keep that social distance. The 6-foot social distancing when in public is still in place. And then Montanans still need to adhere to the quarantine guidelines if they've traveled out of state. All right, so this is straight from Appendix A and the directive. This is specific to general businesses. So all businesses need to be following these guidelines in phase 1 reopening. Health assessments need to be conducted for all employees at the beginning of each shift. And then if you guys have, like in your lobby, in your waiting area, make sure you guys have floor markings that customers can continue to stay in those 6 feet social distancing. If you have a really tiny like lobby or waiting area and you can't make sure that people are entering can stay 6 feet apart, then either close that lobby area or only allow one person in at a time. And then so this, in order to meet those 6 feet social distancing, it may require you guys to reduce the capacity of seating in your facility, especially if you have like a common like area with couches and chairs like that where people can kind of hang out. We definitely need to make sure that people are still keeping their distance. And then this is all phases in the reopening directive. Employers must follow these guidelines here. So employers have to develop and implement policies that will ensure that they are performing the industry best practices regarding social distancing, temperature checks and symptom screenings, and sanitation and disinfecting. And employers need to be making sure that they're monitoring their workforce and that their workforce is self-monitoring for COVID-19 symptoms and not coming to work when sick. Okay, so we put together this package, if you will, for our retail food and bar establishments. And it is a little specific to them, but there's so much good stuff in here that you guys can really utilize, and it's still gonna pertain to what you need as well. I do see that my chat box is blinking. Oh yeah, I should say, let's hold questions till the end. Feel free to put them in the chat, and at the end of this presentation, we'll go back through the chat and get those questions answered, and we'll also open it up for a good question and answer for everybody. But let me just get through my spiel and then we'll go back to those questions. So we have this COVID-19 reopening guidance for retail food establishments, but inside this guidance package, we have an employee health agreement for COVID-19 symptoms that we've created, a facility plan for cleaning, sanitizing, and disinfecting. This facility plan, the next one I have, the third thing listed for social distancing and reducing shared contact surfaces, is very specific just to the food and bar retail food establishments. So I crossed that out because if you don't have retail food or you're not serving food at all, then that won't pertain to you. And then we have a training log and some really great like posters and signage that you guys can utilize. So we're gonna go through that in more detail. Okay, so here's the employee health agreement for the COVID-19 symptoms. So this is awesome that you as employers can print off multiple copies and have each of your employees go through it and then initial and agree to meet these requirements. These are straight out of what the directive is asking. The directive asks employers to make sure their employees are monitoring themselves before each shift. So there's some new symptoms that were released by the CDC for COVID-19, and we included those in here. So we all know coughing regularly, difficulty breathing, and fever were the symptoms, but now it's also including feeling feverish, muscle aches, chills, sore throat, headache, and loss of taste or smell are now included symptoms of COVID as well. And then it's very important that individuals who are coming to work are adhering to the following guidelines from the directive that we went over just in the first slides of washing hands, avoid touching their face, sneezing and coughing into their elbow, disinfecting surfaces as often as possible, and using a face covering when they can't meet 6 feet social distancing. So just to clarify, is it required that all your employees sign this specific document? No, but it is required that employers have developed and implemented policies to monitor their workforce, and that all individuals are performing health assessments before they come in at the beginning of each shift. So this will help you meet that requirement. So here's the facility plan for cleaning and sanitizing and disinfecting. Again, the introduction, it does, because we made this specific for bars, breweries, restaurants. I just crossed that out in here because it's still a great resource for you guys to utilize, and I still recommend you do. It goes through when you should clean, when you should sanitize, and when you should disinfect. So as hotel operators and staff, you already know when you need to clean and sanitize, but disinfecting is a little bit stronger than sanitizing. So follow CDC and EPA guidelines on how to disinfect or what concentration you need to use in order to disinfect. But one common chemical that you can use that you probably already have in your establishment is chlorine or bleach. And to disinfect, you just need to use 1/3 cup of bleach per 1 gallon of water. And that will be effective against the coronavirus. And then I just want to reiterate, when we're disinfecting, you really want to make sure that you're not disinfecting like food contact surfaces and areas where people might eat or drink off of. Just use sanitizer concentration for that. So if you guys do any food in your establishment, any breakfast or anything like that, or have coffee pots, you just want to make sure you're using the food safe sanitizer that you follow, because you are adhering to the food code rules and regulations when you serve food in a hotel. So use your sanitizing solutions for those, but let's use the disinfectant, the stronger solution in all those other areas. And so this is still that cleaning and sanitizing plan. And there's a spot for employers to sign. So you guys can sign this and just say, hey, this is our the plan that we're going to use and implement for additional cleaning and sanitation. And make sure all of your staff are aware of that and know the rules and when to clean and when to sanitize versus disinfecting. So again, do all employers have to sign this? It's not required from our department that you sign this and turn it back into us. But in order to help you meet the guidelines that are required from the governor, we made this plan for you to help you. So you have to develop and implement appropriate policies for sanitation and disinfecting. Here's that plan for you. And then this is a great way to track the training for all of your employees. Like if you've trained them on this cleaning and sanitizing log and on employee health, then you can have them sign this. So you can print off multiple copies of this. And that way you know that you've trained your staff on those specific new policies during this reopening. And then I just want to go into a little more detail specific to hotels, how to clean and disinfect your guest rooms during COVID-19. It's really important to know that hotel staff may not always be informed if they have had a positive case in their hotel. Reasons are, you know, the HIPAA requirements, and also asymptomatic individuals. We don't know, maybe I stayed at a hotel and then I didn't get sick for a couple of days. And so there was no way that we knew that I was asymptomatic at your hotel at that time. And then it also takes a while for trace back. So once I did get my positive case, that room had already been cleaned and sanitized by the time you guys got notified, like you had a positive case a few days ago. So it's important to clean and sanitize your guest rooms as if you possibly had a positive case in that room. So we are recommending you follow CDC guidelines on how to clean and disinfect when COVID-19 was in a facility. These are links to the CDC website, and the interim recommendations for community facilities with suspected confirmed coronavirus link goes straight to the CDC guidelines. And then this one with the household with suspected or confirmed coronavirus is also how to clean and sanitize. And the information in those links I incorporated into the next few slides as well. So it's really just reiterating things you guys should already be doing, but it's maybe just cleaning and sanitizing those more high-touch surfaces a little more often than you typically would, and wearing gloves and being very adamant about glove use and hand washing and disinfecting. So wearing gloves, have all your housekeepers put a pair of gloves on before they enter and start cleaning a guest room. They need to take those gloves off immediately after they're done cleaning the room and wash their hands right after removing the gloves so they can keep themselves protected. Any areas in the guest room that are visibly dirty do need to be cleaned with soap and water before you use a sanitizer solution or a disinfecting solution. Otherwise you can't adequately disinfect if you haven't cleaned the surface first. So use an EPA approved sanitizer that's listed on the EPA website. This is a link to that. And again, these slides will be posted on our website. But like I said earlier, chlorine is approved to be effective against the coronavirus. And so is your common quaternary ammonia sanitizer that a lot of you guys utilize. And then again, I did mention this, but chlorine is an effective one. And those are the strengths. So 1 teaspoon per 1 gallon is sanitizing, and 1/3 cup per 1 gallon is for disinfecting. Okay, so guest rooms specifically, if you guys are providing any dishes, any coffee machines, coffee pots, or ice buckets, And speaking to ice buckets, I know you guys will give them an ice bucket and typically give them a plastic bag or a plastic liner, and you're not actually wash, rinse, sanitizing the ice bucket. You're just giving them the liner. I think I always have recommended this all of my 5 years of doing this job, that you guys wash, rinse, sanitize those ice buckets regardless of giving them the plastic liner. But it's very important now that you guys are wash, rinse, sanitizing that in between each customer checkout. So if you don't know how to wash, rinse, sanitize, or you don't do dishes typically, but you do have an ice bucket and you don't have a 3-compartment sink, you can go out and buy little plastic tubs, little like plastic bins, and keep 3 stacked in like a housekeeping cart. And so they can set it up, one with soapy water, one with rinse water, one with bleach water, and they can wash their ice bucket that way. And then housekeeping staff really need to make sure they're disinfecting or sanitizing all those touch surfaces. So when they come into the room, they need to be doing the light switches, the door handles, backs of chairs, TV remotes, nightstands, alarm clocks, even like the AC, like heaters and controls where guests might be touching. They need to be sanitizing all of those things right now. That's really important. And then it's also important, maybe consider even doing routine shampooing of your carpets or taking the drapes down and washing those regularly too. And then for linen and laundry. So I know as the public accommodation rule states, you don't technically have to wash that top blanket that goes on the bed. If your inside sheet blanket that does get washed between each guest gets folded over the top blanket at least 6 inches. During this time, we highly recommend all top blankets, all throw blankets, all pillow shams, everything that is in the room gets washed between each guest. And then very important, this is a rule in the public accommodation rules as well, you guys should be following already, but labeling your clean, dirty laundry, or your clean bins and your dirty bins for laundry. Clearly keep those bins labeled and never put clean linen in what was holding dirty linen. That will definitely be a place for cross-contamination to happen. So be very clear with labeling or using red for dirty and blue for clean or something like that. Always wear gloves when you're touching dirty linen. Don't shake out the laundry. So talk to your housekeeping staff not to be shaking it out. Once they're done handling dirty linens, they need to take their gloves off and immediately wash their hands. So making sure that there's a hand washing sink in the laundry room. This is why it's required that there's a hand washing sink in the laundry room, provided with hot water, soap, and paper towels, always stocked with soap and paper towels, so that we can keep our housekeeping staff safe. So they need to be removing their gloves, washing their hands at the hand sink, and then provide hand sanitizer in the laundry room so they can utilize that as well. And then we went over, don't shake your laundry, and then use the warmest appropriate water setting, so hot water and dry on high heat, if for all items that you can do that with. And then I just wanted to put in here, these last 2 bullets I did just copy straight from the CDC. Dirty laundry from an ill person can be washed with other people's items. So if you did have a positive case and you did their laundry with somebody else's laundry, all the laundry will be cleaned and sanitized equally when it's done. Some more just things to touch on, some tips and reminders for general facility, the hotel lobby area and the common area. We kind of talked about this. If you can minimize upholstered furniture, do that, because that's pretty hard to clean and sanitize. Use some floor markings for social distancing. Put some signage on the front doors of your establishment, reminding people not to come into your establishment if they're sick. And then if you have a large lobby area, you can even put like some signs up or some table placards, like keep your social distancing, blah, 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 just to keep reminding people. And also provide hand sanitizer in multiple and convenient locations, so people are utilizing that and keeping good hygiene. And bathrooms that are available to be used in like the lobby that can be used for anybody throughout the day. Sanitize or disinfect it. Oh, I should say disinfect those throughout the day. More than once a day would be recommended. Obviously wear gloves when you're cleaning the bathroom. and wash your hands immediately after removing your gloves. And then you can utilize signage in the bathrooms to remind guests to wash their hands and to remind them to use a paper towel to turn off the faucet and to open the door. Maybe put a trash can by the door so you don't have a pile of paper towels by the door. Okay, so face coverings. This is always topic of conversation, so it's good to talk about. So face coverings, like we talked about earlier in the guidelines for all individuals, face coverings are recommended to be utilized by staff when 6 feet social distancing is not feasible. So we'll go into what's a face covering. We really want you guys to be utilizing the cloth face coverings and making homemade face coverings if you don't have access to a face covering. Here's an example of a homemade face covering. We just want to prevent people from going out and trying to find bulk supplies of the N95 surgical masks and face masks that are supposed to be used for healthcare providers and our first responding staff. So if you have those medical grade face masks already in your possession and you already had some before all of this happened, feel free to utilize those. We're not saying don't use them if you have them, but please don't go out in search of them. There's tons of tutorials online and on YouTube on how to make like no-sew cloth face coverings. And a lot of common mistakes happen when you're wearing a face covering. You'll see people out in the stores just constantly touching it, messing with it, pulling it down, pulling it up. And so you really need to make sure that you know a face covering is only a good addition to social distancing and only will help you prevent the spread of this virus if you do it properly. So washing your hands before you put it on, not touching your face once it's on there, and not constantly readjusting it. So I'm going to show you a quick demonstration on how easily you can contaminate your face covering and how your face covering can contaminate you. Alpine Motel, I see you guys in my little box over here. Let me know if you can see the YouTube video with a thumbs up or if you can hear it. So that video does a great job of just showing you how easily the outside of your mask can contaminate the rest of your face, and you can contaminate your mask with your hands as well. So here are some printable resources that we made that you can find on our Healthy Gallatin website. We have these posters we were thinking you could place on your front entrances and your windows or your doors. So we have the Stop, Stay Home When You're Sick poster, phase 1 reopening guidelines. What is phase 1 and what does that mean for Montana? Just reminding people keep their social distance, wear their face covering if they can, and some self-monitoring guidelines are here as well. I'll show you how to access those when I remote in with my computer screen. So this is a great resource for you guys as well. It's the COVID-19 symptom check for employees, a log that you can do so you can make sure your employees are self-monitoring. So each day they come in for shift, you can have them sign this, and then that way you're monitoring your workforce and ensuring that they're performing a health assessment prior to each shift. And you can print off multiple copies, and I'll show you where you can print this off from our website as well. So I will share my screen and show you guys how to access all these great resources. Okay, so www.healthygallatin.org. This is our health department website, and you will just click here for coronavirus to get to the coronavirus page. And then just scroll down, and on the right side, you'll see reopening printable resources. And this is the one you want to click on, the printable resources. And then in here, it's clearly outlined. And we have a toggle for specifically to you guys. So you click on that, and everything I just went over is listed here. So we have the health agreement, the symptom check log. Here's the facility plan for cleaning and sanitizing, the staff training log, and then your posters that if you would like to post those on the front door, which we would recommend you do. And then we also have the reopening. So I just clicked on the right side, the reopening tab, and we have guidelines for all phases. Phase 1, here's the governor's directive, and that has all of those slides I showed you with the copy, those pictures I took straight from the directive, you can find in here. Another great place is the covid19.mt.gov. It looks like this, and the Joint Information Center is where you can find all of the past directives that have been issued during this entire emergency. So you can find everything on this website as well. And then also Reopening the Big Sky has the directive and the phased approach. These FAQs right here, phase 1 reopening FAQs, are awesome. They have so many great questions answered in here. So take a look at this if you haven't read through these. They even answer some questions that I had not even thought of. So this is a really great one. Again, that's on the covid19.mt.gov reopening the big sky FAQs. So I will go back to my slides, and dphhs.mt.gov also has some good stuff, especially if you have like a food establishment in your hotel. And then cdc.gov, always going to recommend them for additional guidance on cleaning and sanitizing, what to do if you're sick, what to do if you have a positive case in your establishment. CDC is the place to go. And then after this webinar, if you still have questions about anything, our COVID-19 call center is staffed with sanitarians like myself, as well as a public health nurse. So you can always call that number weekly from 8 to 5. It's 548-0123. And you can also email that email, and they're checking it all day long, callcenter@readygallatin.com. Super fast response to the email as well. Okay, so I will open it up to questions. I did want to ask, before we get too deep into some questions here, how many of you guys have serve food or are planning on doing a breakfast of some sort during this time? If anybody is planning on doing that, please unmute yourself and let me know, because there's some additional guidance that you have to follow.
Super 8 West Yellowstone will serve a brown bag breakfast handed out from the desk behind spit protectors.
Okay, perfect. That is awesome. Roy, I would recommend that you watch the webinar for our retail food establishments today at 3 o'clock. And if you'd like to email me, I can email you the link to that, just because it does go through what's required if you want to serve food under the guidelines. So I'll put my email in here, and I'll send you the link for that if you would like to email me after this, so you can hop on that webinar.
Yeah, absolutely. Thank you.
I can't hear you. Oh, I sent that privately to Janine. I'll send this to Roy. Okay.
So Megan, there was a question that Jeff had for hotels that offer a continental breakfast. What are your recommendations on what we should offer our guests? So maybe just briefly talking about some recommendations would be helpful.
Sorry, Lori, it's really hard to hear you.
So I'll try again. Can you hear me now, Megan?
Yeah.
Perfect. So there was a question from Jeff, who had a question for hotels that are offering continental breakfast. what are your recommendations on what they should be offering guests? So maybe just a brief outline of those recommendations would be helpful for folks on the phone right now.
Okay, still barely could hear you, but I think I got the gist of it. Question was, if you want to offer a continental breakfast, what are the requirements? You have to follow the requirements of retail food establishments. So Governor Steve Bullock did a reopening phase 1 guidelines specific to all retail food establishments. And there are some strict guidelines and protocols on there. I do have that information on the slide deck. I could go through it right now, but I don't want to be wasting other people's time that it has joined this webinar. If they have questions specific to hotel, motel, we can get those questions answered. And then if the people who do have interest in learning about what the retail food establishment guidelines and requirements are, can stay on, and I'm happy to hop back onto my slide deck and go through those requirements with you guys. Does that sound good?
I have a question. Jeremy from the Brandon Arn Inn in West Yellowstone.
Okay.
What are the recommendations for distributing the brown bags? I believe our hotel is also going to be giving out brown bags. Should we have it in our normal breakfast area? Should we have the front desk deliver the brown bags? What would you suggest for the delivery method?
The brown bags is a great idea. I really like that. The thing with that is you just need to make sure that you guys are not providing any self-service items like on the counter. So if they just have walk in and you have social distancing, floor spacings marked out on the ground, maybe signs like don't touch any, like if you touch a bag, take the bag. And then you make sure everybody's keeping 6 feet social distance when they enter the breakfast room to grab their bag and then leave. And then if you do allow any seating in your room, that room has to be seated 6 feet. Every table needs to be at least 6 feet apart so people can keep their 6 feet social distancing if they do decide to sit down. And then you also need to make sure that your breakfast room capacity is cut in half. I would highly recommend anybody who wants to serve food watch the retail food webinar at 3 o'clock today, or when everybody else is done asking questions that are more pertaining to just hotel, motel, staff stuff. You guys can stay on, and like I said, I'm happy to go through those slides with you guys at the after we have the people who don't want to listen to the food stuff log off.
Thank you.
This is Deborah with the West Yellowstone Bed and Breakfast, and we normally serve a full breakfast, which we will still do, but we will put it on trays and then serve it to the individual rooms. And then we only have 3 rooms. And that way, of course, the trays and all the utensils and everything will stay in the room so that we can properly sanitize it with the dishwasher.
Deborah, that sounds great.
Thank you.
Deborah, that sounds great. Do we have any questions from hotel owners, staff, and breakfast staff, or tourist home that aren't relating to food?
Megan,
Yes?
this is Garrett Osler from the Madison Hotel in West Yellowstone. I emailed you or chatted you a message, but we have self-serve liquid coffee and hot drinks. What is the stipulations of that? I missed that in the presentation of whether that would be allowed as long as we're servicing the area and stuff like that. Do we have to handcuffs? Do we have to not do this for a period or what?
Yep, great question. Thank you for bringing that up. I actually just completely didn't even think about putting that self-service coffee and like waters that you guys usually have in the lobby area. I didn't even have a chance to put that in the slides, so thank you so much. That's a great question. Right now, you cannot have any self-service like coffee, water, or even, you can't even set out like pastries or fruit for people to just grab themselves. Everything has to be behind the counter and served to a customer. So I guess, what you can do is have just the coffee pot out, but the cups can't be grabbed themselves. So you can have like a water jug or a coffee pot, but everything else, like their sugar packets, the cups, the lids, the straws, need to be behind a counter and handed to a customer. That way we're ensuring that people aren't just touching all these items and contaminating these clean and sanitized single-use items.
Sure. But can we control the cups and stuff and then have the dispensers still in a public area?
Yeah, sorry, at the beginning of that, I felt like I maybe have confused you more. So you can have a coffee, like a coffee jug or coffee pot and or a water jug in a public area, but you can't have any straws, cups, lids, or anything like that. So in order for them to get coffee, they'd have to walk up to the front desk and ask for a clean single-use cup.
Or provide the cup in their room and then they can go get it on their own?
Yep, that would work too.
Okay. One other question. It's pretty unique to us. We have 8 rooms that are hostel style, or they have a sink in the room, and then they have a lockable, separate shared shower facility and public restrooms to use. What are your feelings on those things other than more frequent cleaning?
Oh man, that's a really great question. I might want to actually look into that a little bit more before I
Call me
answer
back.
that. Yeah, Garrett, who are you with again?
We are the Madison Hotel in West Yellowstone.
Okay, how would you like me to get back to you? Phone number or
You
email?
can call me. Yep,
Okay.
406
Let me write that down. Okay, 406?
646 7745.
Okay, I'll look into that for you. Thank you so much for asking that question, Garrett.
Yeah, currently we've
Hey,
removed the opportunity for people to continue to book those rooms, but they're very popular with our single hikers and guests that are coming through because the rates are very favorable. And we're just trying to figure out what we do to continue that, because it's about 30% of our property. You know, it's eight rooms of 31.
Okay, yeah, I really have a strong inclination that those rooms are probably not gonna be advised to be open during phase 1, but like I said, I will look into this and get back to you.
Thank you.
Mm-hmm.
Megan?
I would like to add
my-
something
Yep.
on Garrett's question about the public coffee. If it's not a coffee pot, if we have a push button auto dispense, we can take all the condiments, obviously restrict those. What are you recommending if there's an auto dispense immediate coffee producer?
Yeah, same thing. So I like to use the analogy of, like, think of a gas station where somebody wants to go fill up a soda pop. They can still choose their soda, but in order to fill up their soda, they have to go to the cash register and ask for a cup. So it's the same thing for you guys. You have to be able to provide them with the cup and straw from behind the counter, and then they can go utilize the soda machine or the coffee pot, sanitize wherever a customer may be touching, just continuously throughout the day.
Megan, in addition to the Super 8, I also run a campground. We have shower facilities where the tenters especially shower. It's not practical to disinfect or sanitize showers in between people. You'd have people lined up all day waiting to do that. Where are we at with this?
That's a great question. I have to admit, I have been really focusing on some specific types of businesses putting together these webinars, and I haven't done a ton of looking into campgrounds and shared, like the hostels and the shared shower situation. So you are probably going to be somebody I'd want to look into that question and reach back out to you personally, unless Lori has an answer, but Jara might have an answer. She's a sanitarian at the call center. She joined us today as well.
Hey, I'm just gonna pop in really quick because I actually get this call frequently at the call center, which is where I'm sitting. So if you're not able to sanitize those facilities properly, you would need to have those facilities closed for the duration of phase 1 at this moment. If that is to change, then we would let everybody know, but in all the guidance documents and the directives, currently those facilities would have to be closed if you're not able to sanitize them.
So would that be sanitizing between individual showering is what you're talking about?
So not necessarily, but in terms of like every hour or so kind of going through and making sure that those things are being cleaned. But the problem is going to be how many staff can you have to ensure that those facilities are being cleaned and maintained, as well as a restriction on how much cleaning product you have as well.
Cleaning product and staff aren't so much of a problem. It's just how often it has to be done.
Yeah.
Thank you.
No problem.
This is Brian at the Alpine Motel in West Yellowstone. I have a generic question. I know we're talking about phase 1, but any insight as to when you think the 14-day quarantine from people coming from out of state or internationally will cease?
Lori, you want to?
Sure, I can answer that. Megan, can you hear me okay this time?
It always just cuts in and out. I think it's the headphones.
Okay, so at this point in time, the 14-day quarantine is still in effect. That includes any traveler into Montana from out of state for a non-work related purpose. And that means that the visitor must stay within the boundaries of the property and can't leave those boundaries, such as to go to grocery store, restaurant, public outdoor recreation. And at this point in time, we don't have any indication from the governor as to when that directive will be adjusted. As with all the phases, there's a lot of metrics that we're looking at statewide as well as locally. In terms of the number of new cases, hospitalizations, and our capacity to test. And I know that a lot of people want to know exactly when phase 2 will begin. We've just started phase 1. And so a lot of that depends on how this first reopening goes and all the measures that I know that you all collectively are putting into place to keep our community safe. So hopefully that answers the question about the quarantine. I do not have any more insight as to when the governor may change that at this time.
Thank you.
Lori, thank you. This is Jeremy from Brandon Iron Inn in West Yellowstone again. And this could have been, I was on the call a little bit late, but what is the property's responsibility minus educating visitors coming to our town? What is our responsibility after we educate them about the 14-day quarantine if they're in town for something other than work?
Yeah, that's a good question. So the Department of Commerce, as part of the directive, should have advised all of you to include notice of a mandatory quarantine for travelers. So that notice could be a simple sign on your property that just reminds anyone who's traveling from out of state that they have that 14-day quarantine, that the 14-day quarantine is in effect. And I typed into the chat the specifics that you can mention on your signage. So we can send that up in a follow-up email to all of our public accommodation establishments as well, so that you have that and you can just copy and paste and use it for your own.
Thank you.
It looks like we have some stuff going on in the chat. I'll do my best. I'm starting at the top. So Trish put, do we need to do temperature checks on guests? No, the guests should be following these guidelines that that our governor Steve Bullock put out for all individuals to be monitoring themselves. And then if you post those posters to not come into your facility if you're feeling sick, then the individual needs to be responsible for doing that themselves. And then Rex asked, he has a horseback business in West Yellowstone. They take customers into the mountains above the park. When will Yellowstone be open? Gallatin County will play a big part in this. Are you going to push for the opening? Let's see. I don't have the answer for that. That's something the governor is gonna answer. Lori, do you have?
Yeah, I answered it right below that one for Rex.
Perfect.
There's no date certain for when Yellowstone National Park will open. What I can tell you is that our health officer, Matt Kelly, has had many conversations with our park superintendent, as well as he's been in touch with his counterparts, other health officers in the surrounding communities in the region, so that the park, as it continues to think about their plans for a safe reopening, we want to make sure that it's done safely, so that those gateway communities such as West here in Gallatin County are prepared and have the measures in place to keep their residents and their visitors safe.
Okay.
This is Sue Ann Chow from Terra Nova Cabins in West Yellowstone. Can I just quickly go back and revisit the quarantine question? As we have employees that are going to be coming in from out of state to start working, those employees will need to quarantine for 14 days before they start working. Is that correct?
I believe that is correct. Lori, is that the proper guidance, that we're still saying any employees that are coming to Montana to work need to self-quarantine for 14 days before? Or was the guidance as long as they are only attending work activity, then when they're done working, they have to be quarantining?
You got it. Yep. So if they're in Montana for work-related purposes, they can work, but outside of work, they need to be quarantining. So that means limiting their activities, just like I was mentioning before, not going to the grocery store, going to restaurants, or doing public outdoor recreation.
So Ann, could you hear Lori?
Yes, I did. So that helps clarify. Thank you.
Perfect.
The problem that I see, this is Rex Portman. The problem I see with this quarantine, one, it's going to be very difficult to get employees here into our area. Most of these employees that come to our area work with the public. And so you're saying they can do their work, great. They're going to be with public all day, then they go in quarantine at night.
Yeah, so Rex, I'll just add a little bit more detail to that too. So again, because of, as an employer, and across all phases, one of the most important things that you can do is make sure your staff are educated, whether or not they've come here to work from another community or country, that they understand the symptoms of COVID, what your policies are in place to make sure that they're not going to work if they're sick. So just remember, like anybody who's unwell, that includes all of you. If you're unwell, you should be working. And so, continuing to stress the importance of that in your own business, despite what type of setup you have, is going to be really important, whether or not they're coming from another country to work or another community to work, is going to be critical here.
I had Rebecca in the group chat ask, are there any requirements of time? Does the room need to stay empty prior to cleaning? Also, any requirements for length of time in between reservations? So the CDC is recommending that you wait 24 hours before you clean and sanitize a room if you know that it was a positive COVID case. Otherwise, there isn't necessarily any requirements of time that you need in between cleaning and sanitizing, except for the fact that you need to make sure you can clean, sanitize, disinfect, and allow all those surfaces to air dry properly before a new guest were to come into that room.
Speaking of, this is Jeremy from the Branding Iron Inn in West Yellowstone again. Speaking of employees leaving the state and coming back, I have a question about, of course, here in West Yellowstone, we always think we're unique, but the closest Walmart is 85 miles in Rexburg. Bozeman is just a little bit longer than that, but takes a lot longer to go through the canyon. So given a geographical area where like maybe a Rexburg or Idaho Falls, somebody might go shopping and then come back, would be very normal. And Bozeman has seen cases percentage-wise similar to New York, where Eastern Idaho has not. Is there any issues with allowing them to go down there and come back and still not have to quarantine?
Lori.
I'm trying to make sure I understand the question. I'm going to repeat the question, so hopefully I am answering it correctly. But are you concerned about your staff traveling to Bozeman and then coming back to West Yellowstone to work?
No, negative. My question is, if somebody leaves the state and they drive 85 miles south to Rexburg to go shopping at Walmart and they come back, rather than going up to Bozeman, Rexburg, Idaho, rather than going up to Bozeman, which is in the state and they don't have to quarantine, but Bozeman's, Gallatin County's rate of infection is almost similar to what New York is, which is crazy. And Eastern Idaho, Rexburg, Idaho per se, is extremely low, but it's within our normal travel geographical area that somebody would do. Do I need to tell those employees they can no longer go to Eastern Idaho to shop?
Right, because you're saying because they're going out of state. Is that correct?
It is correct.
Yeah, that's a good question. And, you know, for this specific webinar, what I'd like to do with you in particular, maybe I'm going to suggest this for other folks down in West, because I think you have a very unique scenario there where we want to be able to support you as best as possible. That maybe we schedule a specific West Yellowstone public accommodation webinar, so we can really, I'm seeing a couple thumbs up, so we can really dive into the details here. Because we have folks from across the county on this call right now, and I just want to be able to support you guys down in West as much as possible. So after this, Megan and I are going to sit down and we'll identify another time where we can just work with the operators down in West. That sound, I'm seeing thumbs up on that.
That's definitely a huge yes. That would be great, because you know, it is a unique thing down here. And what about doctors? Half the people in West Yellowstone go to Bozeman, half the people go to Idaho Falls or Rexburg. So it's awkward to tell somebody they can't go visit their doctor, or somebody that's in a normal geographic area. It's much closer than going to Billings or Missoula. You know, Idaho Falls is right there. And so it would be interesting to have that call at a later time. I appreciate it.
Okay, yeah, we'll do that. That's great. I think that that's going to be helpful for a lot of other things. And because we want to be able to honor everyone's time, I want to go back and read some of the other questions in the chat.
Yeah, while you're looking those up, I see one from Lisa and Brian regarding pools and hot tubs. Does until emergency is over possibly mean phase 2? Yeah, it's really going to just depend on what the governor decides to do. So in phase 2, it looks like some very minimal guidelines are already out for phase 2, but it's likely that once we enter phase 2, a whole new set of guidelines will be put out. So we're just going to have to keep on staying updated with what is happening at the state level.
Megan?
Yes.
This is Janine. I'm the shipping and receiving manager up at Big Sky. And my question is there a protocol on guest belongings, how long they should be possibly kept or cleaned or sanitized, or is there, you know, some kind of thing that's been discussed about that?
If somebody leaves a belonging behind and it's like now.
Well, that too. As far as the inbound coming in for guest stay, such as luggage or, you know, skis or, you know.
Okay, because you guys, guests show up, you guys take their luggage up to the room for them? Is that what you're meaning?
Yes. Yeah.
Okay. I would just say that your staff just should be properly taking precautions with wearing gloves when they're handling those items.
Okay.
And then remove their gloves away.
Okay.
Hand wash.
Okay. Perfect. Thank you.
Mm-hmm. Somebody asked to explain sanitation versus disinfecting again. Sanitation is just a less strong concentration. So what you might sanitize with is not going to be as high strength as what you disinfect with. So you want to make sure when you're disinfecting areas like bathrooms, highly touched surfaces like doorknobs, light switches, countertops, but sanitizing is more for the food surfaces like tables and dishes.
Megan, there was a question about vacation rental settings. Do they need to remove bulk salt, pepper, and coffee filters from the kitchen?
I'm sorry, Lori, I didn't hear the beginning of that.
In a vacation rental setting, do you need to remove bulk salt, pepper, and coffee filters from the kitchen?
Yeah, so there is going to be, if you're doing any food service, there should be no items out that customers can grab and use themselves. If they want salt and pepper, you should give them a single-use package of salt and pepper that they can use and then throw away.
Megan, this is Lisa from Lewis and Clark Motel. Can you hear me?
Yeah, you're a little quiet, but I can hear you.
Hi, Megan. Thank you. I was wondering about ice buckets. So we were thinking of, rather than leaving them in the rooms, that we would do the self-service behind the desk, a sanitized bucket with the bag and hand out individually near the ice machine. Would that be okay?
That would be great. Thank you.
Thank you.
Roy asked, where can you find this recording? We're going to post this on the Healthy Gallatin website, and it's going to be under, when you go to the COVID page under reopening, or if you don't find it there, under printable resources, under the hotels, motels toggle that I showed you, where all this guidance is, will be this webinar. It won't be up by the end of today, so probably Monday. Sorry, I'm just looking through the chat. If there are any questions that we didn't answer regarding just hotels, motels, staff, stuff not food related, please ask those now. Otherwise, I can go into some more food related stuff for the ones who want to listen to that. How will you let us know the time for the West Yellowstone accommodations? We will probably be able to send out Lori, correct me if I'm wrong, an email out to all of our licensed establishment owners in West Yellowstone once we get that figured out and scheduled. Perfect.
Sorry, about sending that out to all the licensed folks. Could you also have the chamber do a distribution? Because a lot of times the owner may not be on property, may not check their email soon enough. And the chambers, our local chamber here is pretty aggressive and great at getting information out, especially from the county. So I appreciate that.
Awesome, Jeremy, thanks. Yeah, we can do that.
Megan, can I have one more question?
Of course.
So my staff is confused on the 14-day quarantine. So we have the sign posted, and of course the staff knows about it and understands it. The guest is confused. The guest is thinking it's, just us, or thinking that they don't understand what it means. In other words, they're, likely the guest isn't going to say, okay, check me in for 14 nights. So we're trying to figure out how I answer my staff when they say to me, what are we supposed to say to the guest?
Jara, do you want to help us out on this one?
Sure. So one of the things with the 14-day quarantine is the directive states that it has to be either quarantining for the 14 days, or if it's a lesser time. So let's say they book 3 nights, then they would need to quarantine for those 3 nights with you. You do not have to be responsible for ensuring that they are doing the full 14 days with you. Sometimes, unfortunately, we're going to have people take some responsibility for themselves. But if you are having any issues with people coming in and having those questions, you could hand them the call center number and let us take that burden for you. That way they're not trying to get upset with you guys and you try to explain the directives. We are here for that support for you guys, and we're here Monday through Friday. So have them call the call center.
Okay, thank you. This is Sue Ann from Terra Nova Cabins again. I think that what this comes down to often is that the guests knowingly are intending to stay. They book a room. They're coming to Montana to visit, to fish and recreate. And we know that when we take that reservation. So the question then becomes that, do we accept a reservation for less than 14 days because we, you know, as the guest is going to go out and recreate while they're staying with us? Or do we just simply say, you know, if you're from out of state, we can't accept your reservation at this time?
I think what Jara was just explaining was saying you can accept their reservation even if it's not 14 days long. They need to be being responsible as an individual, that they're quarantining themselves throughout their stay. I mean, even if they're out fishing, they can keep social distance and be alone for the most part in those settings. But it's not your responsibility to make sure that they're following those guidelines. Correct me if I'm wrong, Lori or Jara.
Okay, so I think I'm just clarifying for the hotel folks that we're not liable and responsible, you know, have the liability and responsibility that, you know, obviously we cannot monitor our guests, and that our responsibility is to notify them, educate them of what the requirements are, and say la vie.
Yes.
Okay.
Thanks, Sue Ann.
Thank you.
All right, any more questions that haven't been answered yet? And then we can dive into a little more food specific stuff.
Hello, this is Kathy from a VRBO unit, and I missed the first half hour. I'm so sorry, but is there somewhere that I can catch up on what you had to say about VRBOs and quarantines and disinfectant? Thank you.
I am going to have this, well, I'm recording this webinar right now, and we are going to post this on our Healthy Gallatin website under the COVID page. You can go to printable resources and then find the hotels, motels, and this webinar will be posted under there. So I would say go ahead and take a look at the slides and the PowerPoint that we went through. If you want to email the call center at callcenter@readygallatin.com, I can have them email you the PowerPoint slides as well. But we didn't go into anything specific for tourist homes or VRBOs. It's all pretty general from the reopening guidelines for individuals, employers, and businesses.
Okay, thanks.
Thank you. Question from M something. I saw the finger raise.
Oh, this is Mike Gottlieb from Grizzly RV Park. And the question I had was, are we required to do temperature checks of our staff before their shifts, or can we just ask them if they've done a temperature check and rely on that?
Your staff should be doing those things individually on self-monitoring themselves. And you are just there to make sure and monitor that your workforce is self-monitoring. So if they tell you that they don't have a fever, then that's them giving you that information. So utilize that employee health agreement document that we made, and then really iterate to staff. They need to be making sure they're self-monitoring before they come to work each day.
Thank you.
All right, everybody, thank you so much. If you do have additional questions, call the call center at 548-0123. And with that, I'll have the people who don't want to listen to the food specific information log off, and then I'll go into a few more slides and we can get in a little more depth on the food.
But before that goes further, just in case I jump off, I know a large part of the West Yellowstone community down here really appreciates you being able to do this online to help us out and keep us educated. So at least from me, my staff, and most of the folks I work with down here, thank you.
Thank you for joining us today, Jeremy. I would recommend you watch the next few slides since you are providing food. Okay, awesome. Thank you, everybody. I'm going to share my screen now back to the PowerPoint slide. All right. So this is going into the guidance for retail food establishments. If you're a hotel, public accommodation, and you're serving any type of food or drink to the public, you have to follow the retail food guidelines. So the FDA food code, as well as the guidelines that the governors put out for this reopening. So all phases, if you're doing this, you need to have a cleaning plan implemented. Employees must be trained in proper sanitation and health policy. So all the things we already talked about. And then this is when it's really specific. So phase 1 for retail food must follow these specific guidelines. And we outlined them. I'm going to go through these in more detail in the next few slides. And the purpose of this is just to help you guys meet the requirements as smoothly as possible. And we understand you can just do your best with this. So I'll just dive right in. We went over this. This is the beginning of that package. And this package, we already kind of talked about this, isn't required that you sign and submit, but it is required that you meet the requirements of the directive. So this is the facility plan for social distancing that is very specific to food establishments. This is the one that I crossed out for hotels and motels because I didn't want to go into this depth, but everything on this facility plan for social distancing, you must follow if you're going to provide food to the public or drink. So your capacity in the establishment for seating or for the breakfast area must be 50% of what your normal operating capacity is. So you're gonna have to allow for social distancing, that 6 feet social distancing between each table. You can't have more than 6 people sitting at one table. And in order to meet those 6 feet social distancing requirements between tables, you're probably gonna have to remove some tables or put signs on tables as closed. If you have back-to-back booth seating, that's okay. That does allow for a separation. Self-service operations are not allowed during phase 1. You cannot have a breakfast buffet, or you cannot have food sitting out for self-service. You can't have salt, pepper shakers. You cannot have cups and lids sitting out. So all those self-service breakfast bars cannot operate at this time. You'll have to come up with a different approach in order to serve your guests. And then the facilities have to have all patrons out by 11:30. That's not really going to pertain to you guys because you're not serving breakfast at 11:30 at night. If you have refillable containers, that's not too relevant to you guys either, but those need to be cleaned and sanitized each time. Drink refills are not allowed unless they have a clean single-use disposable cup or a cleaned and sanitized cup that they grabbed from behind the counter that you guys handed them. Any table items that you might have sitting on the tables, like the napkin dispenser, should not be out, and you guys should just provide napkins upon request. All of those things, if you have like some kind of decor that sits on the center of the table, it would have to be sanitized after each guest uses that table. So if you have high traffic breakfast room and people are sitting at the tables and you cannot sanitize the table between each person sitting there, then you need to take your tables out because after somebody uses that table, it needs to be sanitized. And then if you have menus, the menus need to be clean and sanitized between each person. So utilize maybe a whiteboard where you can write the menu so nobody's actually touching it, things like that. And some of this still doesn't pertain to you because most of you guys don't have bars, but if you do have a bar, nobody can be sitting at the bar. You can't have any bar service at the counter at all. All service has to be served to drinks and food all have to be served to a guest at a table. And then casinos, not really pertaining to you guys, but they have to meet cleaning and sanitizing and social distancing as well. And then the cleaning plan needs to be implemented, and so does employee health training. So this facility plan for social distancing is an awesome way to meet all these requirements, and you as employers can sign this and teach your staff what is specifically in the governor's reopening directive. All of these bolded boxed bullet points here are required if you're going to serve food. And then what to expect. We are having a health department presence in the community, and we will have a sanitarian coming down to West Yellowstone next week just to do some friendly check-ins and make sure everybody's operating appropriately with the new phase 1 guidelines. And if anybody needs any clarification or education or just has some questions, then we will be able to be that resource for you guys. So that was the rest of the spiel. I guess I probably could have just went into it with everybody there. Hopefully that answers some questions. If you guys have additional questions now related to food, please feel free to ask those.
Hello. This
okay, Jeremy from the, oh wait, go ahead.
No, go ahead, sir. You're fine.
Yeah, so I'm just going to oversimplify my identification of, since we're continental breakfast, which is considered a buffet, on phase 1, at least for now, we're 100% shut down. We feel more safe with the brown bag anyway, but we really don't have another choice, either no breakfast or brown bag. Is that correct?
Yes, and also ensure when people are coming and getting those bags that they are not within close contact of each other.
Yeah, do our best. Thank you so much again.
Thank you, Jeremy. Roy, you had a question?
Hi. Yeah, I'm the executive chef at the Covered Wagon Ranch. We are an all-inclusive resort guest ranch, and we do breakfast, lunch, and dinner. From sounding like all these guidelines, we're not going to be able to open our lodges. It's 2 big giant tables, and it's all family style. So we are planning on doing sending out breakfast, lunch, and dinner to our guests through bag bags or to-go boxes. And then some great questions on the self-service coffee and all that stuff. My question is that this is a lot to take in. I mean, that's pretty much the safest way to do it, right? Is just everything is to go, everything is delivered. And then as far as my kitchen goes, it sounds like all my staff is going to have to wear masks because it's a tiny little kitchen and we're not all there. Yeah, sorry, it was more just like a rant.
I know, it's a lot. Yeah.
I mean, is there any idea when phase 2 could happen in the state of Montana?
Lori, do you want to answer that?
I'll try to, but I am not sure if you guys can hear me. Can you hear me okay?
You're doing great.
Okay, thank you. So I know this, I tried to explain it a little bit earlier. I know it's really frustrating when you're trying to work through timelines and understanding like when's phase 2, but it really, like I said before, it depends on what goes through phase 1. So how we work as a community to get through phase 1. And really it's looking at a series of metrics. So those metrics, like I had mentioned just briefly before, include things like how many new cases that are in testing capacity, as well as again, the volume of tests we have available, the number of people who are hospitalized, deaths both in Montana and in Gallatin County. So all of those are factored into when phase 2, we move into phase 2. And that is not a local decision. That is something that the state and the governor decides, and how we move from phase 1 to phase 2 and what that timeline looks like. I hope that helps.
It does.
Roy,
you guys are doing great. Thank you so much.
Thank you for joining us. And I was going to say, you can be innovative in how you think about if you have like very minimal people at your guest ranch and you want to allow a table of, or a family of 6 or less to come in and use the table and eat dinner in there. If you're staggering like families coming in at different times and you're cleaning and sanitizing the area that they're eating dinner, that's okay. We want to make, I mean, use your best judgment and do the best that you can. But you can still use those rooms if you're like staggering who's coming in and keeping, you know, those close like families just apart from each other.
Okay. I think just on the safe side, we're just going to shut it down.
That sounds good.
Thank you so much.
Thank you. I had a question in the chat from Caitlin. Are amenity trays of sealed food allowed in guest rooms? I would say during phase 1, I'm going to say no, because we're not even having restaurants and facilities have like condiments and sugar packets and things like that sitting out. So if they want those types of things, just provide them upon request right now. Otherwise, you'd have to just throw that product away after the guest checks out. So you could do it that way if you'd like.
So question, we have single cup coffee makers in the rooms. Should those be pulled?
You can leave those in as long as you're sanitizing them after each guest. And if that single use cup didn't get used, you'd need to throw it away.
My single use cups are wrapped in plastic.
I think in that case, I still would recommend you throw it away, because what if somebody was in that room, had the coronavirus and handled that plastic cup and maybe touched it or sneezed nearby it?
Yeah, okay, I'm just asking. Okay, thanks.
Yeah, thank you.
By the way, I've been in a bunch of gas stations over the last couple of weeks, and in most I've been able to just pick up a coffee cup and fill it. I'm just asking.
Yeah, I think.
And not here in West Yellowstone, in Bozeman.
Right. So they were considered an essential business, and they didn't have great guidelines before this phase 1 went out. And so when the phase 1 was introduced, and that was part of it, the people who were already operating like those gas stations probably didn't realize that that is a requirement, and it wasn't clearly outlined before the phase 1 reopening directive was out. So that is something that we do need to do our best to try and touch base with those convenience stores and let them know that that's now something that we are asking of them.
Thank you.
Yeah, thank you everyone for joining us. Do we have any additional questions? Otherwise, if you want to know more about the retail food guidelines, there's a webinar at 3 today. I'll give you a couple more seconds to maybe ask a few more questions.
Go ahead, Roy.
Yeah, I emailed you my email. Can you email me that address for the Zoom, please?
Yeah, actually, Lori, correct me if I'm wrong, but I think this exact same link that you used to get on the webinar today, just use that and it'll be at 3 o'clock and you'll be on the food one.
You are correct.
Perfect.
Thank you.
Jenny?
Hi, thank you. First, thanks guys so much for giving us all this information. But I thought we've been doing a pretty good job. I oversee a group of hotels in the state. But now I'm hearing we should take out our prepackaged coffees, cups, condiments, they're all individuals, from the rooms, and then like ask the guest to check in if they're going to want coffee and give it to them, and if they don't use it, then throw it all away. It's obviously cost prohibitive with our non-amount of guests in the rooms just to be throwing away a couple of cups and coffees and all that if they're not used.
Absolutely, Jenny. That's a great point. I would say upon check-in, ask them, would you like a coffee cup to utilize the single-use coffee that you have in your room, or do you need, that way you're not throwing everything away after each guest, but maybe make that a new question that you ask upon check-in.
Okay, but it sounds like we also shouldn't be leaving the coffee or the, prepackaged condiment packs in there unless they were sanitized, I guess, right?
Yeah, that's a good
Get
point.
stuff out of the rooms.
Yeah, and I just want to reiterate, we're all just doing our best. We are reopening in phase one, nice and slow, but we just want to, you know, do the best that we can to keep our community safe. And everybody, you know, there's mistakes that will be made, but we all just need to take our own individual responsibilities and do the best that we can.
Yeah, I'm sure we make a million mistakes. I just trying to do the best, like you just said, the best that we
Yeah,
can.
we do too. We get it. It's just human.
Thank you.
Thank you.
Megan, Mike from Super 8 West Yellowstone again. I'm not yet open for the season. I actually opened 3 weeks from today. If we're in phase 2, the condiment packs can stay, or is that not known yet?
That has not been determined yet.
Thank you.
Any more questions? Alpine Motel, did you have a question? Hi.
No, I was just saying thank you so much for all that you're giving, all this information you're giving us, and we will use all that we can. We appreciate it, and I look forward to the one you're going to do possibly next week on specific to West Yellowstone with all the visitors we have that come just to go into the park or fish and that type of thing.
Awesome. Thank you so much for joining us.
Thank you.
Jeremy from West Yellowstone, there was a question in the text box. Kleenexes, toilet paper, that gets interesting. I mean, I can understand pulling out the coffee. It would be odd to try and dispose of a roll of toilet paper after every guest stay.
Yeah, okay, that's a good point. This just goes back to let's just do the best that we can. When you pull out a Kleenex, a new, fresh, untouched Kleenex comes out, and toilet paper is kind of similar. It's kind of keeping itself clean, you know, it's all wrapped up. So I just want to say, let's not get too into the weeds here. I think those are okay to stay in the rooms, and we just are going to do the best that we can. And yeah, thank you. All right, with that, I think I am going to head off. So feel free to reach out to us, you guys. We really want to just be a resource for you. And check our website regularly for more updates. Thank you, everybody.